components of the vaccine implementation. But it includes, just as you were discussing
And Dr.
earlier.
Butler, you made that point, and when I was in Tennessee yesterday, the head of the hospital association, I think there are many heroes in the midst of this pandemic the last 10 months, but no more so than our doctors and nurses and people staffing our hospitals and emergency rooms. And it would be altogether fitting for the vaccine to go to them. But your point, well made again, is that as we focus on the vulnerable people in nursing homes and long-term care facilities and people that work there, the recommendation, CDC's recommendation to states, is about making sure that as we see cases rising, hospitalizations rising, that we make sure that the staff are protected, are vaccinated, and continue to give that level of care.
Yes. Thank you. Yes, we definitely want to protect those that protect us, and also recognizing our healthcare workforce is predominantly female, and some of the communities that are heavily impacted by the pandemic are actually overrepresented among healthcare providers. So I think that is the prioritization of healthcare providers will be important for protecting not just the healthcare infrastructure, but also addressing some of these issues that you just raised.
Yeah, very good.
So the components of vaccine implementation include this process of identifying who is going to be vaccinated first, because we will have more people than will have vaccine initially, allocating it out to the states and some of the local jurisdictions to be able to make sure that it's getting to where it can be administered. Distributing it, the logistics of getting it from the factory to where it can be administered, and actually also making sure that it gets into arms and being able to track the safety. And because it's going to be 2-dose regimens, at least for the initial vaccines, making sure those second doses are administered. And throughout all of that, making sure that we're communicating what we know about the vaccine as transparently as possible, and reassuring people that we're telling them what we know when we know it. The fourth slide goes into a little more detail about the